So on one end, you got some hilarious content, and on the other end, you have some very educational content. So I was like, man, I was very impressed. And but you also got an awesome following, and I could see like why, because the content is just it's original, it's hilarious. So I hope you put out some more.
But yeah, the ultrasound is used for everything in the body, everything except, anything that's soft tissue in the body, we use ultrasound. So even the brain, like in adults, we can't really see the brain, the soft tissues of the brain, because the cranium is too thick and the ultrasound beams won't traverse the skull. It'll bounce back. But if you lower the megahertz down to like 1 to 2 megahertz, you can still do a transcranial Doppler. So you can check the vasculature of the brain. You can do the middle, anterior, posterior cerebral arteries and check, those arteries in patients that have had a subarachnoid hemorrhage, or in pediatrics, we do it for patients who have sickle cell anemia. And you can see the blood vessel is very good. We can detect the velocity of the blood flow in the vessel. But in babies, we can see the brain with very, very high resolution, similar to even MRI, because of the fontanelles. So they have the anterior fontanelles and the mastoid, and we can see in the posterior fontanelles, we can see the brain very, very well. We do it primarily for premature infants to detect hemorrhages. Okay. But you can see anything. You can see congenital anomalies like hollow prosencephaly, pretty much similar things you can see in fetuses. Wow. But the only thing we really don't use ultrasound is bone, and you can still see the surface of bone on ultrasound. So if there's like a cortical fracture of the bone, I mean, we've done ultrasounds for soft tissue issues. Patient has swelling, and as we're looking at the tendons and the muscle, we see, hey, look, the surface of that bone is irregular. So then the radiologist will recommend an X-ray, and then they confirm that there's a fracture there. Wow. So it's not your number one go-to for bones, obviously, but even in bones, it can help. Maybe many years ago, the lung, people really didn't do ultrasound for the lung. They did it to rule out if you have pleural effusion, which is fluid around the lung. But over time, they started seeing that you can even see if there's pulmonary edema with ultrasound, because since the lung's filled with air, right, the ultrasound beam just gets scattered around. You don't really see anything on the ultrasound image. But if there's pleural effusion, you can see the fluid around the lung. If there's a consolidation or like fluid within the alveoli, you can see that with ultrasound. If there's pneumonia or necrotizing pneumonia, you can see that with the ultrasound as well. So ultrasound has improved a lot, and even lungs, which back then, X-ray was your go-to, at least initially, for any chest issues for the lungs. But even ultrasound has advanced so much in that. So it's very vast. And almost every patient I get, we get the common things, like the jokes like, oh, that's, am I having a boy or a girl, even though you're scanning the gallbladder? Or you get the question like, oh, how do you know what you're looking at? That's super common. But a lot of things they also say is, oh, wow, why are they doing an ultrasound on my kid or on my teenager? Because they're not pregnant. Right. And then we got to educate them, like ultrasound is the entire body, really. Right. You do ultrasound of the eyes. You can see if there's a retinal detachment, if there's hemorrhages in the eyes. You can see if there's a thrombus in the ophthalmic artery. Just into the entire body. Just the other day, I had a kid came with swelling in the finger, and in the ER, which you kind of think, oh, that's not a real emergency, but they came in anyways, and they ordered an ultrasound and an X-ray. The ultrasound showed very clearly that there was tenosynovitis. There was a bunch of fluid around her flexor tendon. Wow. So the amount of, and in adults, it's used a lot too. Obviously, in adults, they'll, the go-to is more CT, because adults are bigger than the pediatric population. And, with the obesity epidemic, there's a lot of people that are very, very large. And the larger you are, the more the ultrasound beam gets attenuated, and then you can't see the deeper structures. But there's many techniques for even large patients to get good images, because I worked even for 8 years in an adult trauma hospital, and we got great images in adults too. Like I hear a lot of techs complain, and like in my images that I post on my blog and on my Instagram and all that, a lot of things I hear, everybody's like, oh my God, those images are so beautiful. And then there'll be other people like, oh, you never get it like that. And it's true. If you're working with adults, it's very hard. It can be hard. But you can't say you can never get those images when I see people consistently get those images, right, even in adults. So obviously the person's like very overweight, you might not be able to get that image. But we get very old teenagers, even 18-year-olds and 20-year-olds in our hospital And some of them may have obesity, but they still order the ultrasound for appendix. If they come in with right lower quadrant pain, they won't order the CT. And oftentimes we do find it.
Yeah.
It's harder, but it's possible. So I always like to tell people, like, don't limit yourself. Don't say as soon as a big patient comes in, you're like, oh, that's it. This is going to be a terrible study, and I'm not going to see nothing. Because if you don't try, if you start from that point of view, that like, I'm not going to get good images, you're not going to try.
Right.
You know, a common joke amongst sonographers and radiologists is like, oh, the pancreas wasn't visualized. Because if there's a lot of gas, it does obscure the pancreas. But there's techniques you can use. Obviously, when I do ultrasounds, I press pretty hard. Okay. Like, you know, most people that I've scanned students and stuff, they tell me like, wow, why do you press really hard? But I get good images. So that's one thing. I'm not trying to like hurt the patient, but by pressing harder, I can get closer to that structure and move gas out of the way. Another thing you could do is if the patient's not NPO and, you know, they have the okay to drink water, you give them 3 cups of water, their stomach gets filled with water, and it gives you a very, very good window for the pancreas. So, man, there's always techniques, you know, like we're very busy, and a lot of times we're like, you know what, I'm not going to go through all that mission. If I can't see it, I can't see it. They can order some other test. But, you know, when you have that, you know, state of mind, like from the get-go, I'm not going to get good images, you're not. You know, that's just because you're already setting yourself up for that failure.
Yeah. So this is like one of those careers where it comes down to skill, right? Skill and experience.
Very much so. You know, as far as all the radiology modalities are concerned, ultrasound is the most operator dependent, because if you're a radiographer, yeah, your technique can make a great image or not good image. But with ultrasound, it's like literally if your hand doesn't know what to do, you're not going to get a good image. Like
that's true.
With you know, if you use all the parameters that you need for your chest X-ray, and the patient follows your instructions and they hold their breath and they don't move, the images come out good as long as you follow all those parameters. But if you follow all the parameters for ultrasound, you say, yeah, sir, ma'am, hold your breath, and you don't know what to do with your hands, right, you're not going to get the images. And even if you can't get the images, you might not be able to interpret what you're looking at, because we have to also like know what we're looking at. And I've had radiologists come in. I remember one time a radiologist was like, oh, it was a gallbladder polyp, which is a benign condition. It's not a big deal. So I was kind of in awe that they wanted to come back and scan the gallbladder polyp. So I was like, all right, come, let's go back. They started scanning, and I'm standing behind them. It's the patient there, the mom standing there, and the radiologist just scanning. And she, you know, they were taking a while, and I asked her, I was like, do you want me to help you find it? Because I see you're struggling. So I just grabbed, and she said, sure. So I grabbed her hand, her wrist, and I just tilted it a little bit, and it was right there. But that just comes with scanning thousands and thousands of people for hundreds and hundreds of hours. Right. It's different. Radiologists, and there's radiologists that really do know how to scan. There's some that don't. There's some that don't like ultrasound as a modality, because just like us, we see different modalities and we're like, ooh, CT, that's my favorite. I don't really like this one. I don't like that one, but CT, I like that one. It's the same thing with a radiologist. There's radiologists that love ultrasound, and you know the ones that do, because they'll call you and they'll tell you, oh my God, those images were beautiful. Or, you know, they're always singing your praises. But you know the ones that don't like it because they're like, whatever. We'll just order another exam because I'm not sure what that is or whatever. And that's fine. That's like, you know, a lot of them have their own specialties that they prefer and that they're more confident with. But scanning is hard. You know, scanning is really hard. And it's funny because for a long time, I've been working the night shift for several years, and I haven't had any students. And we just, for the first time now, got students overnight. And I love having students. I love teaching them, and I love showing them how to scan. But it had been a long time since I had a student, years. And you just realize, you know, and I go, like, all right, go. This is the protocol. Take these images, you know, and then I go out, and then I come in and I check their images, and I see that they've only taken 2 images. And I forget, I'm like, oh yeah, it's true. She really doesn't have the experience, doesn't have the confidence, doesn't really know how to differentiate a good ultrasound image from a bad ultrasound image. So, but I also like to leave them on their own so they can kind of like, you know, that's what they did with me. And I was able to find my bearings. And then they come and tell you, oh, look, here, your image is too bright. It's too dark. Here, you can use the gain knob to make it, you know, look better. There's also a little row of knobs called TGCs, which is time gain compensation, which you can kind of like, it's like an EQ, but you can use it to, you know, further fine tune the image.
Okay.
And it's funny, like you forget, like it's like riding a bike. You know how to ride a bike, and you're like, oh man, riding a bike's easy. I can do tricks on it. I can jump over that. I can, do a wheelie. But this person's never ridden a bike, so you're like, oh, here, get on the bike. And they don't know what to do. The first thing they're gonna do is fall, because they don't have that muscle memory. So that's the thing I like about ultrasound too. So you get to, put your input into the diagnosis a lot, because another common phrase that you hear, especially from community college teachers, and they drill this into their students' heads, like, oh, ultrasound techs don't diagnose. And that's semantics, because it's true. We don't diagnose. We don't write it, we don't dictate a report that then we give to the patient. Right. But we literally tell the radiologist what we saw,
right,
what we think it is. And, once you've been doing it for many years and they have much confidence in you, it's not I don't think you're right. Or they know, they're like, yeah, you're right.
Yeah.
Not that you're going to be right all the time, because sometimes there's misdiagnosis. A while back, we do get quite a few of, ovarian torsions. It's not very common, but in the pediatric population, I get a few a year. And we had one, and everybody was convinced, the surgeon, the radiologist, me, that it was just an ovarian torsion. And in pediatrics, ovarian torsion happens commonly with a cyst, a very large cyst, but we didn't see that. But in surgery, they were able to see that there was a cyst, but with the ultrasound, we didn't see it. So that's not really a misdiagnosis, because it still was torced, but we didn't see the lesion that was causing that twisting of the ovary. So, but everybody was in agreement that that's what it was.
Right.
So, and if there's ever a question, like if I ever question something, I'll tell the radiologist, like, look, I think it's this, but I'm not 100% sure. And this happened before. And they'll be like, okay, fine, I'll recommend another exam. But if we're pretty sure, that's pretty much it. Like appendicitis, oh, here, this patient has appendicitis, and surgery, they take him surgery and they do an appendectomy. Okay. And we always look at the results of the pathology report that the surgeon sends the specimen to pathology, just to confirm. I mean, we don't have to, because we just know. I mean, you do so many that but it's always good to just confirm those ones that are equivocal, because by measurement, anything greater than 6 millimeters is a positive appendicitis. So we have every now and then one that's 6 millimeters, but they have the other findings like fat stranding, hyperemia, which is increased blood flow to the appendix, free fluid, things like that. So we're like, yeah, this is appendicitis, but that number is like, sometimes the ER, they don't know the nuance of the exam, so they just go by with the number. If you tell them this appendix measures 1 centimeter, they're like, oh, that's acute appendicitis. But that might not be the case, because we've also had enlarged appendixes that are just fecal filled, but they're not inflamed. Patient's in no pain. There's no secondary signs of appendicitis. There's no inflammatory markers, right? By ultrasound standards. So the ER will come like, how is this not appendicitis? The appendix was 1 centimeter. So we got to tell them, like, no, that's not the only parameter we use. It's a normal appendix. The wall is thin. There's no inflammation. It's just large,
ultrasound techs, when you're skilled, you're skilled. And like it doesn't just happen, right? Like you have to love and enjoy what you're doing. And it sounds like you.
Oh, absolutely. Absolutely.
Right?
I've always been of the mind that I'm not going to say that the best techs are creative, but I see a lot of ones that do, because it is imaging, and you got to, you're worried about diagnosis. You're worried about your protocol, because we have to take a set amount of image, just like an X-ray. You have to use your milliamperes and your, all your parameters you need for that specific X-ray, and all the different views you need, protocols. But we're also worried about getting an aesthetically pleasing image. Right. Many times we'll show each other cases, and it might even be a terrible disease. And the first thing we say, like, wow, that's beautiful.
Right.
And it's odd. Like somebody that's not in the field, they'll be like, how are you going to say that a neuroblastoma is beautiful? That's a devastating childhood cancer. But it's like, we're not talking about the disease. We're talking about the aesthetic quality of the image, the way we showed it, the way that all the parameters, at least by ultrasound standards, are perfect for that diagnosis.
Yes.
And we know that the person who took the image is skilled at ultrasound because of how they, of the way it looks. Mm-hmm. So that's the aesthetic quality of the image. We're also saddened that this patient does have this diagnosis, but I don't even get too sad, because I'm also happy that I'm able to help this person get this diagnosis, and then they can begin their journey to treatment. And, with, modern medicine, a lot of these childhood cancers, I don't know the exact percentage, but I think up to like 80% or maybe even more are curable. Mm-hmm. So as a parent myself, you don't want to ever hear that your kid has a diagnosis, but if there's a palpable mass that their doctor felt and they're worried it's a cancer, you want that diagnosis as soon as possible. Absolutely. So the fact that ultrasound was able to find it, they can begin that. They can already, refer them to oncology. And the ordering physician will order more exams, PET scans, and all that stuff. and CTs to further evaluate. But we already got this ball rolling. You know,
Right.
it's not like, oh, the ultrasound was normal, whatever. We didn't see anything. Bye, go home.
Right.
Then weeks pass, the patient still has the symptoms, they come back, this cancer's grown a little bit in that time interval, and it's gotten worse. There might be metastasis now, there's little lesions in the liver. So when I find something like that, I am sad and I feel bad for the patients because nobody wants a bad diagnosis.
Right.
But I'm also happy that I'm able to assist in them beginning their journey to get cured or to get treated.
And the fact that these doctors are avoiding CT is great because all that radiation, right?
Yeah.
So this
Yeah.
other option is a very great option. So this is a career that maybe people should consider pursuing, but don't expect it to be easy, right? It's going to have its challenges.
And it's not easy. You got to like it though. I think I've been doing it now for 17 years. So for me, it's not hard in the aspect that I'm just, experienced in it. But when I was first starting, yeah, it was hard, but I also liked it. So it was never like, oh, This is too hard. I can't do this. I got to quit. It was more like, oh, wow, this is hard, but I love this. I want to get better,
Right. Man, we appreciate, healthcare professionals like you, like for real. And you could set the bar for other sonographers, who maybe aren't as excited or maybe don't feel their job is as important or the challenges, right? Maybe they want to quit in the middle of the program, but there's always going to be challenges, even with the patients, like you said, dealing with kids and giving those diagnoses. That's pretty tough. You got to deal with it. But I think you do an awesome job of dealing with the actual, because I love your Instagram posts, your TikToks, hilarious.
Yeah. Thanks.
Hilarious, like. And I figured you were genius because to be that funny takes, you got to be very clever. And so on one end you got some hilarious content, and on the other end you have some very educational content. So I was like, man, I was very impressed. And I guess I wasn't on social media enough, so I'm kind of late. But you also got an awesome following, and I could see why, because the content is it's original, it's hilarious. So I hope you put out some more. Thank you for what you put out.
Oh, absolutely, yeah. I've always loved teaching the ultrasound because once I got experience pretty good at it, I was always a magnet for the students. They'd always come to me. I'd take them around the hospital, show them the things. But I've always been also a joker. I don't take myself too serious. Healthcare, as many people know, is very stressful. Sure. And we do see people suffering. We do get burned out. I had heard about burnout my entire career, and I was always, I don't think that exists. I've never, I don't feel burned out until it happened to me. I was like, oh wow, this is real. You get burned out. You just have no compassion for anything. You don't care. You're just tired of everything. You're overworked. And I'm sure it can happen in any profession.
Absolutely.
So that burnout and that stress, and I know that a lot of healthcare workers have great sense of humor because we're always joking, in the face of seeing, tragedy. And even if you're not seeing tragedy, you're stressed out and you have a coworker that is, a pain to work with or whatever. Everybody is always joking around and laughing.
Yeah.
So when I started the page, I started it with the focus of education because I have, a lot of cases, a lot of experience. And I also want, by teaching, it always keeps it new for me.
Right.
I'm always teaching basic anatomy stuff too. That stuff that I know the back of my hand, but it just keeps it new. It doesn't get boring. It's not like, oh God, yes, fine. Yes, the celiac axis again. Who cares? No, it's like, oh, look at this picture. How pretty. Again, for the 1,000th time, because it's a pretty picture. So at first I started with the educational stuff, and then I was like, yeah, let me make some joke stuff because I'm a joker, and the people appreciate that a lot as well. And I'm glad that I'm able to do that because I see a lot of radiology websites and a lot of radiology Instagram accounts, and they're very formal. And I understand it. These are big organizations. I know the Cincinnati Radiology has a great Instagram, but their stuff is all educational. It's very, very white coat, very formal. They would never post even a meme. You know what I'm saying? So I'm not an organization. I'm one person.
Right.
I run this page literally by myself.
Yeah.
So I can pretty much do everything I want. I always keep in mind, because my sense of humor is really dark, and I know a lot of healthcare workers' sense of humor are really dark. So I always gotta tiptoe that fine line of not. And I also have a very, very dirty mouth. I curse like a sailor, but you will never see on any of my videos me cursing or any of my posts me writing curse words, because I am also a professional,
Right.
and I still want to. I want people to be, oh yeah, he's funny, but not, oh, he's funny, he's crazy, oh, but he's, you know, he's wild. No, he's funny, but he's still a professional.
Absolutely.
You know, so I'm able to do things that, you know, the ART Instagram can do, and the ARDMS Instagram can do. All those, you know, websites, and I don't know, they're boring.
Right,
you know,
right.
You know, they provide some content that's good, but you see their posts get like 2 likes because nobody cares. You know, when you can get the same content from somebody else who's passionate. You know, the ARDMS has got one goal, and that's to make money from sonographers and from doctors and from nurses who are getting their registries in ultrasound. That's their number 1 goal. Sure. You know, so as long as I keep on making these tests and having people take these tests and they're making money, that's it. They've accomplished their goal. Whereas my goal is to educate and entertain. So edutainment, you know, kind of. And I've also seen other accounts that are similar, where it's education, but it's not boring. Right. You know, today I was at dinner with my family and we were talking about college classes and stuff like that. And my wife said, so when I took economics, it's boring, because economics is boring. It really is. But I guarantee you, there's a professor out there that has an economics class that people are dying to get into. Absolutely. Because they do it and they make it fun. People just want to take that class because it's a boring subject. But this one person does it so great and makes you want to learn. And you can do that with any subject. Okay. So you can either have a teacher that's just there, just literally reading PowerPoints, you know, monotone voice, half the class is asleep, or you can make it fun. So that's why I wanted to add the funny stuff as well.
And I got to tell you, I appreciate it. And today, you're absolutely right. The students of today are not the same students of 10, 20 years ago. So you cannot approach education the same way. And if we want these students to come out qualified and skilled, then, you know, educators need to adapt too, right? Just what you're doing, you know, and we can't complain about them if they haven't changed. Like, well, you haven't changed. Students are changing. The information is the same. You just got to find a way to put it out there. And you do that very well. I think you're ahead of the curve. So again, thank you for that. And absolutely, the boring stuff, that snooze and pass along, right?
Yeah, I mean, it's definitely a generational thing. Obviously, if we have professors and teachers and techs that are maybe in their 60s and they're getting close to retire, they went to school in a different era where it was like, oh, medicine's very, you know, cutthroat, and there's, you know, it's very serious. You're dealing with human beings. But, you know, it doesn't mean that just because the person is 60 doesn't mean, because I know I follow Elliot Fisher, who runs the CT is Us website and Facebook. He's got this guy, you know, he's not young. And he provides great content. He doesn't really joke or do like memes and stuff, but every now and then he does. Every now and then I see on his Facebook, he'll post a YouTube clip to a Beatles song, you know, and that's cool. I show you, okay, this person is not just a professor and doctor of CT. He's also a human being that likes music and likes to joke around. He posts, you know, like medical themed humor jokes on the Facebook. And, you know, I know he works in Johns Hopkins, and his website is super famous. This has won awards and everything. So I kind of wanted to do my page similar to him, but I'm also much younger, and I wanted to put, you know, much more humor into it, because sometimes people don't, you know, I have so many students following the page, but I have so many seasoned techs too. And sometimes seasoned techs really don't care about seeing another case of gallstones. But if you post something that they can relate to, that's very funny about, you know, a hospital experience, or, you know, a joke that's relatable to their profession, they eat that up just like I do. And I see other meme accounts and joke accounts, you know, posting stuff that I literally laugh out loud because it is super funny, you know. And another thing too, that like when people reach out to me, I get, I mean, I don't ever like to, you know, brag or anything like that, because I still try to be humble. People think I'm super conceited and super arrogant or whatever, but I'm not. I try to stay humble, you know. And I get literally hundreds of messages a day, primarily on Instagram.
Okay.
And I answer every single one. There's not one message I have not answered.
Wow.
me what's my favorite registry study material, I go and tell them, and I'll go out further, and I might tell them about videos I've done that is about similar things that they're looking for. But I try to help out everybody, because another thing, like you said, our younger generation is using the internet and social media very much so to learn. Absolutely. I learned so many things on Twitter. I follow doctors that do ultrasound on Twitter and sonographers that on Twitter, and the doctors that do even other things in medicine. And I learned so much. Same thing on Instagram. Every now and then they'll post something and I'm like, wow, I did not know that. Right. So the younger generation is definitely, we're already spending a lot of time behind screens on our phone. Right. So why not put that there? When I started and doing ultrasound, I was always on the internet, because Google is already around. Right. So I was always on the internet just looking for content. But there was no such thing as social media. It didn't exist yet. So there was web pages, and those Radiopedia and Ultrasoundopedia, and one of my favorites, which is ultrasoundcases.info, which is a website from the Netherlands, which has been recently purchased by another company. I think they're called Sonoskills or something like that. But their old page, very basic, no fancy, nothing, no fancy graphics, no cool animation, nothing, just text. And I want to learn about liver tumors. You click on the link for liver tumors, click on the link for all the different types of liver tumors, and then you get case after case after case after case after case of liver tumors of all types of varieties. And I learned so much with that. That wasn't a textbook.
Right.
So that's why I enjoy social media for the educational and the entertainment aspect too, but a lot for the educational aspect, because this wasn't around when I was starting, when I was really seeking that out. So I'm glad that this is around, and I'm able, and other people are able to provide that content that people are they're looking for it, because I was looking for it feverishly, because a lot of times you find a journal article and it's locked behind a paywall. Right. And you might be in a hospital, your hospital pays for all the journals so you can read it for free. But if you're at home, I'm not paying $30 to read an article about gallstones. Right. There's literally thousands and thousands and thousands of pages online about gallstones, and if you want to learn just the basics, or if you want to get real in depth into the theories of how gallstones are created, it's all there at your fingertips. Wow. There's no reason to not learn.
Yeah. Wow. And you're on multiple platforms. So I mean, it's true what you're saying. You're trying to reach as many. So currently, which platforms are you on?
Yeah, I have the webpage is sonographictendencies.com. That's just where I write my articles. There's nothing there. There's no jokes there. That's just a regular cut and dry website. I try to make it look nice so it doesn't look just like a boring old school website. Then there's the Instagram, which I get a lot of, get a lot of interaction from. People are always reaching out to me there. And that's also Sonographic Tendencies. I'm on Twitter, but on Twitter, I think my name is Henry Stacks, or Trigemini Henry. It's not Sonographic Tendencies, but I'm on there as well. I'm on Facebook with Sonograph. On Facebook, it's called Practical Sonography, Sonographic Tendencies. I'm on TikTok as Henry Stacks. On there, I post, there is a free-for-all. I'll post jokes. I post music because I play guitar and record. So I post my music stuff there. There's everything. Everything, whatever's on my mind, I'll post there on TikTok. So it's not like, but there's a lot of ultrasound, meme video jokes on there as well, because I create them there and then I'll share them on the other platforms.
Okay.
And I think, and then YouTube, also Sonographic Tendencies.
YouTube, man, and they're all great. They're all of them. And TikTok, I mean, is the newer one probably, right?
Yeah, I mean, I remember when TikTok started, like, I was probably sounding like a boomer. I was like, oh my God, TikTok, I don't want to do that. That's another thing, And but I downloaded it to see what it was like, and I was like, I don't know about this. It's just literally just like, I would scroll and it's literally just girl after girl, just, shaking their thing, and I'm like, all right, I guess there's a market for that, but it's not, I don't know if I can use it. But I think when the pandemic started, so many people flocked to TikTok that then you started seeing content that was comedy, content that had to do with art, content, construction TikTok. There's TikToks about everything.
Yeah.
So once I started seeing that there was so much content on there, I started enjoying, using it for me, not to like create, but just to, enjoy myself and just endlessly scroll through, funny videos or learning stuff. I've learned stuff on TikTok too. And then I started, I've made a couple, here and there, but I was like, kind of like cringy, I didn't know what to do on TikTok. But then, I started making some funnier ones, and I got one that, it got like, I think it got like 1 million views. It was like a joke about because it's relatable, because that anybody can laugh at that, because it's about gender reveal parties. So I thought that was pretty funny. This is all knowledge that I would give no matter what. You know, like on YouTube, I do make a little bit of money because the videos get views. So, but on Instagram, the videos get thousands and thousands of views. I don't make any money off that, and it's fine. I'm not trying to monetize that. You know, if somebody would want to like advertise on my page, and it's some company, ultrasound company that I really like GE, wink, wink. No, I'm just kidding.
Yeah,
I wouldn't mind. You know, I wouldn't mind. You know, having them advertise on my page. But I'm also not reaching out to them because that's not my goal. My goal is not to make money. My goal is just to educate and make people laugh. That's it. That's what I do with my family. That's what I do with my kids. That's my job in life. I like making people laugh, you know, so that's just it.
That's awesome. That's awesome. So can I ask you about Linda? Where does she come about? Like how did...
I have no idea. Like, let's say, the funny thing about Linda is I had my student that just started, and I was like, you know what? I haven't taken a break. I'm gonna let her leave. You know, she's young. She just started, so she's gonna take a little while with the patient. And I'm like, look, start scanning this patient. I'm gonna go get some water, and I'll be back. And I was just sitting in like one of the back rooms, just drinking water, and the idea just came to my head. I actually worked with someone years ago as an EKG tech, and I'm pretty sure she's older, so I'm pretty sure she's not on Instagram or any of that stuff. And if she is, I don't care. And her name was Linda. But the character that I created at that moment, it was literally off the cuff. It has nothing to do with it. She doesn't sound like her. I just got the name. Like, I was like, what am I going to call this character? That I literally sat in the room. I opened Snapchat, and I saw the filter that made me into like an older lady. And I was like, I'm just going to start freestyling. And I just started talking. And I created the quick video. And it was like one of those blooper reels, because it was like, boop, boop, you know, just her saying things. And I was like, what should I call her? And then I was like, Linda. I don't know. It just sounded good. And I remember that I worked with that person called Linda, who's always complaining about her knees. So I thought that was going to be a funny name. But that's the one thing too. I don't write scripts for anything. I don't like, if I do some TikToks where I'm like showing the ultrasound image on the TikTok as a green screen, and I'm like pointing at then all that stuff is just freestyle. I don't script anything, nothing. Wow. Just yesterday I did one which is like on TikTok, you could put your eyes on inanimate objects and act like you're them speaking for them. So I just sat there and I just kind of like off the cuff just did one with the transducers. Like if the transducers were in a meeting talking to each other and, you know, and fighting or whatever. And then like a punchline at the end. That stuff's all like, I don't write that stuff down. I'm literally sitting there like, okay, what am I gonna say next? And then I hit record. And then I stop. I'm like, all right, what should I say next? And then I hit record. And sometimes I'll do a whole thing and I look back at it. I'm like, it's not that funny, you know, but sometimes I'll look back at it and if I laugh, you know, because if I'm laughing at myself, then it's pretty funny because I'm usually not gonna laugh at myself. That's weird. So if I watch the video back on another day and I'm like, oh my God, that's kind of corny, then I'll be like, okay, I don't think that was that funny. But even though other people are like, oh my God, that's hilarious, I myself, I'm like, I don't really. But if I look back at it and I smirked or I smiled, I was like, okay, I did. That one came out good. So it's really whatever comes to my mind. Sometimes I'll see something or I'll see a meme. And I'm like, man, this is an old meme. I'm going to turn that meme into a video, you know? Yeah. Or other times I'll read something. And it's a lot of times it just literally pops into my head. All the little things, the funny stuff I create, a lot of times it's just something I'm like, oh, I gotta record it right now because I'll forget it. It's almost like music. When you're a musician, sometimes you'll hear something in your head or you're just there with the guitar, just kind of playing around with it. And you come up with something that sounds cool. You're like, I have to like get something to record this because if I don't, I will forget it. And it happens so often. And it's happened with funny videos too. I'm like, what was that thing I want to record? I don't remember. And it might come back to me later. I don't know, but it's all just freestyle.
Yeah. Just thinking about the transducer one, it's making me like laugh because that was genius. We're having a conversation with each other, and
it's funny because like I said with that one kind of has, you know, a suggestive at the end because the last transducer is an endo cavity probe that we use inside the cavities of a human body. And I was there thinking before I posted, I was like, what if someone says that's not funny or that's inappropriate? Because this happened. I posted stuff that is truly, truly, truly not inappropriate. And somebody on Instagram would be like, that's so inappropriate. And I'm like, you know, or I remember once I posted one where about, you know, the patient's leaving AMA and somebody reached out to me in private messages like, you suck. I can't stand you. That's the most, you've never been a patient? Of course I've been a patient. We all have, you know? And I was like, I'm not trying to like make fun of people. I'm just trying to make fun. Yeah. So before I posted that one, I was like, I'm going to post it, whatever. I don't think it's really that bad. You know, I'm not using any bad words. I never, like I said, in real life, I curse like crazy. But in these things, I try to just keep it as neutral as possible to not, inspire any ire from people, because people on the internet are just dying to complain, just dying. Today or the other day, yesterday, I got a comment on one of my videos on neonatal spine ultrasound. The guy was like, or the guy, the girl, I don't know if it was a guy or girl, but they're like, oh, the music in the background is so obnoxious. It's absolutely unnecessary. This sucks. So I just gave him a heart, because like, what am I going to say to that? I don't really care that they don't. It's not for you. Other people have had no problem with it. You know what I'm saying? There's, like I said, there's the amount of information on the internet is endless. If you don't like mine, go find the video that doesn't have the obnoxious music, which quite frankly, I don't think it was obnoxious. I thought it was a pretty good song because I wrote it. So if you don't like it, that's fine. Go watch the video of the old dude or the old girl in a white coat speaking about, spine. Oh, here we have the lumbar vertebrae. Bro, fine. Go watch that. My stuff is going to be a little bit more animated, and it's not for everybody, but most people seem to like it, so that's fine.
Oh, absolutely, absolutely. Yeah, you find that balance where it's and I'm telling you right now, like, I enjoy it. I think it's hilarious, and I can see why a lot of people watch it. It's genius, and you're in the field, so you know exactly how to connect with other people. So
it's exactly is what I would laugh at, pretty much,
Absolutely.
And I know a lot of people who do skit comedy, whether it be in a niche, like I know there's Dr. Glaucoma Flecken, who's an ophthalmologist who's hilarious. He's on TikTok, but also on Twitter. I started following him on Twitter before, like way back then, but he does medical humor. And he's hilarious. I don't know if he scripts his stuff. He probably does, but I know there's people who do skit comedy like that do script it. They'll write the script for each person. They practice it. I can't do that because it doesn't come out to me personally. It doesn't come out naturally, and that's why I would never be a comedian. My entire life, people are like, "Oh, you should be a comedian. Do stand up." No way. I would suck so bad, because as a comedian, you write your material, you practice it, and then you deliver it to people.
Right.
I've never been funny like that. Like, I can read a joke and it doesn't hit. But if I'm being spontaneous my entire life with friends, with family, whoever, just me being spontaneous, they laugh and they crack up because I'm just being my funny self. But I'd be a terrible stand-up comic. I can't do it. And I have a lot of respect for people who do, because it's a very cool skill to have, to be able to, and then read these jokes night after night,
right, and
still deliver it in a way where it's fresh. It's not like, oh my God, he's been saying this joke now for the last 5 months on tour. No, it's hilarious. Yeah. So no, I couldn't do stand-up comedy. I think that one TikToker, the ophthalmologist, I think he says he does, or he has done stand-up, and bravo to him. It's not for me.
Right. No. You got plenty of platforms, and as long as you enjoy it, right? That's what's important, is that you enjoy it.
Absolutely.
Yeah. So, and it's easy to tell. It's easy to tell. But man, that's, like I said, I'm happy that you're a guest here. Is there anything you would like to promote? I mean, you're obviously really good, but is there anything like your fans or anybody interested could look forward to, or what can we expect from Henry?
Promoting wise, same thing I said earlier. My webpage, Sonographic Tendencies, and Sonographic Tendencies pretty much across all platforms. I have a few followers on Twitter, and for some reason they've been growing. I don't know how, because I really don't post that much on there, but I do post primarily educational ultrasound stuff on Twitter. So almost everybody on there that follows me is doctors that do a lot of point of care ultrasound, or what they call POCUS. Wow. So they follow my account, for that. But that's pretty much it. Just those accounts, which, I get new followers every day, so that's great. That's the only thing I really have to promote. What to look forward? Just more of the same. Just, funny stuff. Hopefully I can keep on coming up with stuff. I have lots of ideas, so I haven't run out and gotten burned out yet. So